Have you ever had upper back pain that doesn't quite behave like muscle tension? Maybe it doesn't change much when you stretch or when you massage, it only helps temporarily? Or the discomfort seems deeper, harder to actually pinpoint? Or you notice that it seems actually related to things like digestion or breathing or stress? Hi, I'm Alexis Wadeland, osteopath and nutritionist at Blossoming Me and Healthy Learning Lounge. Today, I wanted to talk about one of the common and sometimes overlooked contributors to upper back pain, referred and visceral pain, meaning pain that doesn't actually originate in the muscles or the joints of the upper back at all. To understand this, we need to zoom out from structure alone and look at the thorax, your chest cavity, as a shared space where organs, nerves, fascia, ribs, vertebrae, and breathing mechanics all interact. Your upper back and rib cage don't just support movement. They house and protect vital organs, your heart, lungs, trachea and esophagus, and they form a protective roof for the stomach, liver, gallbladder, pancreas and spleen. Each of these organs has connective tissue attachments. These fascial connections link them to the diaphragm, to the rib cage, the sternum, the thoracic spine, and helps them to be able to move but still be suspended comfortably within the abdominal or chest cavities. They also share nerve pathways. Our brain does not directly identify nerve activity from organs as it would from, say, skin, because generally signals from organs about pain aren't necessary. So when an organ is irritated, inflamed, restricted in its mobility, or under stress, the nervous system can get a bit confused and interpret that signal as pain in the musculoskeletal structures that share the same neural pathways. This is called referred pain. For example, heart-related referred pain can present not only as chest pain, heaviness, pressure, but as pressure or aching through the upper back, often between the shoulder blades and generally towards the left, but not always. It could travel to the arm, usually the left again, and the jaw. Commonly, pain from the gallbladder will refer into the right side of the upper back or beneath that shoulder blade. Sometimes people might describe it as a gripping or a start-stop spasm type pattern. Pain from the gallbladder can be linked to digestion of fats. So pain often intensifies after a fatty meal. Stomach and reflux irritation can create burning and aching beneath the sternum, but this can also radiate through to and up the thoracic spine. This is often quite a deep ache and it doesn't change with movement or stretching. Interestingly, it turns out that heart attacks in women can present more like this than it does in men, with the traditional sensations in the chest and the left side of the body. Lung irritation or inflammation can present as an aching or a burning type pain. Generally, it would be noticed with deep, intense breathing, but can often be felt as aching in the upper back area more often. Now, it's important to say here, if pain is sudden, severe, unexplained, or associated with symptoms like breathlessness, dizziness, nausea, or chest pressure, medical assessment is essential. It's always better to rule out serious causes first. But in many cases, especially when symptoms are mild or they fluctuate and they're long-standing, the interaction between the tension of the organ, fascia, musculoskeletal guarding becomes more relevant in the conversation. Because organs don't float freely, they do glide small amounts and they do kind of rotate and move. They may descend a little bit and recoil with movements such as breathing. They rely on the diaphragm's movement, the rib cage's elasticity, and the fascial system's flexibility to function optimally. This small movement helps those organs to drain their lymphatic fluid, keeping the organs healthy. When breathing is shallow or suboptimal, diaphragmatic movement and pressure changes between the chest and the abdomen are reduced. Postural compensations also alter the tensions and the pressure through the abdominal and thoracic cavities. These changes then compromise digestion and reduce organ motility slightly. The opposite is also true. When organs are irritated, their fascia tightens, further restricting motility of the affected organ and pulling on the surrounding structures, the diaphragm, the psoas muscle, the anterior, lateral or posterior abdominal and thoracic walls. This then will cause tension in the deeper and then subsequently the more superficial muscles of the thorax in a protective capacity, in an aim to guard and hold the body more rigid to avoid damage to those vital insides. This results in tension, muscle aches, and reduced mobility. People often describe this pattern as a deep ache in the mid or the upper back, generally, commonly between or even under the shoulder blades, or even into the shoulder, but it seems to be hard to stretch away, or difficult to replicate the pain with finger pressure. Tightness in the back, linked to eating, often but not always bloating, abdominal discomfort, and reflux might be felt. Stress or increased exertion may worsen the pain, especially if it is heart or lung related pain. Discomfort that seems to fluctuate, and here a pain diary might identify hormonal or digestive changes and links. This is where understanding the body as an integrated system really becomes so important. Upper back pain is not always a local mechanical issue. Sometimes it's the musculoskeletal system responding to its internal load. This doesn't mean that the organs are diseased. It often means that there is a bit of strain, mechanical, chemical, or neurological, and the surrounding structures are adapting to support and to protect them. First, we need to confirm that in fact the organs are actually okay, and then we can focus on supporting the whole body. If we can help to balance the whole body's fascial tensions, the organs become more comfortable and able to subtly slide and glide. From here, the nervous system is also able to feel safe because the organs are no longer signaling irritation, and the muscle system is no longer needing to hold so tightly and rigidly for protection. So knots, muscle fatigue, aches and pains, as well as joint irritation and mobility issues can all begin to settle and return to comfort. In individual assessments, we would look not just at the ribs and the spine, but at breathing mechanics, the diaphragm movement, fascial tensions, digestion, and nervous system tone, because restoring organ mobility, rib expansion, and diaphragmatic function can often reduce the protective tension in the upper back. At the same time, there are gentle ways that people can begin to support their system from home, through breath work, rib and thoracic cage mobility, postural awareness, nervous system regulation, helping both the organs and the musculoskeletal system feel less compressed and guarded. If your upper back tension seems to be linked to digestion, breathing, stress, or fatigue, it may be that the body is holding protective patterns around deeper systems, not just tight muscles. And that's something that can be assessed, supported, and gently released and retrained. If this perspective resonates, there are two main ways that we can support you through this work. First is through individual clinical care, where your breathing, rib mechanics, organ mobility, nervous system regulation can all be assessed and treated in a personalised, unique way for what's going on right now for you. And second, through guided programs like the Ribcage Reset mini course, which helps you to begin to restore rib and thoracic movement, breathing mechanics, and fascial and muscular ease, all at home, either as a starting point or alongside treatment. If your upper back has been carrying more than just physical load, know that your body isn't malfunctioning, it's adapting and it's protecting you. And with the right understanding and support, those protective patterns can begin to soften. I really hope you found this useful, and please feel free to like, subscribe, or share it with someone who might also be dealing with this kind of persistent upper back pain tension. And if you'd like to explore working with us further, you'll find the links to both clinic care and the programs below.